This is huge. I don't know why it hasn't made a news headline. A massive study just published in the New England Journal of Medicine found that a specific combination of drugs could potentially stop advanced prostate cancer from metastasizing. In other words, from spreading. So if you are a man or you know someone who is dealing with prostate problem, specifically prostate cancer, they will actually be glad that you share this information with them. Now, this is an international clinical trial involving over 1,000 men from 244 medical centers across 17 countries, which makes it a truly substantial study. All participants had a high-risk biochemically recurrent prostate cancer where the PSA level rises rapidly after surgery or radiation. Now, PSA, which is the prostate-specific antigen, is one of the most important biomarkers for diagnosing prostate cancer. So if your PSA level is very high, most especially after surgery or after radiation, that could simply mean that your prostate cancer is metastasizing again, is spreading again, all right? So in this study, all patients were randomly assigned into 3 groups in equal ratio, 1:1:1:1:1, all right? Now the first group received hormone therapy, androgen therapy, like neutroprolide. So how this medication work, how this drug work, is by stimulating your brain to stop the production of testosterone, to stop the production of androgen. Now the second group received combination. They received both hormone therapy and this medication called enzalutamide. So how this medication work is by blocking the androgen receptors, thereby blocking this testosterone and other androgen from binding to those receptors. Now the third group received this medication alone, enzalutamide. Now the primary endpoint of this study was metastasis-free survival, which is basically how long men stay free of cancer spread or death. Now, quoting from the HOSMAT, from the researcher's mouth, the hormone therapy, which we've been offering our patients for 30 years, has not improved survival nor nothing else. That is from the researcher's mouth. So what did they find in this study? Well, after 8 years, men who were taking both hormone therapy and this medication enzalutamide were doing far better, and in fact 78% of them were still alive compared to 70% on standard hormone therapy. Now the hazard ratio was 0.60, which means that there was a 40% lower risk of dying, which is very substantial, which is very significant. Now what is also interesting is that enzalutamide alone did not result in any significant difference compared to the hormone therapy. So what this means for your health is that if you are a man dealing with recurrent prostate cancer, taking this combination, hormone therapy and enzalutamide, may actually give you a real chance to live longer and better. Although this study also presents some limitation, while the survival improves, it also may result in negative consequences for people like fatigue. Now, also considering the people who usually have prostate cancer, mostly men who are above the age of 50. So the hazard ratio reflects all-cause mortality, not specifically from prostate cancer. So some deaths may actually are not caused by prostate cancer. They may be caused by other problems. Now, one other concern I also noticed is the founding bodies like Pfizer as well as Astellas. They are the founding body of this study, of this research, okay? And then they are the developer of this medication, enzalutamide. So that also may raise concern. But overall, this is a great study, and this is a good news for people who usually have prostate cancer, all right? Thanks for watching.